One of the important things that's there in a lot of diseases, including a lot of hair loss, is inflammation, and this technology is so good at reducing inflammation.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, how are things going? You know, I've been thinking more and more about how we regenerate. Is that weird?
Oh, no, it's not. You know, I'm a wound healing guy, and we think about this all the time. We have a journal for it, but probably more than one. And it's been a very hot topic over the years, how we leverage the biology in the skin and beyond. You know, there are stem cells and other very potent molecules that our body makes. And through generations of scientists have been really trying to leverage this. And if you will, get to the stem of it, so they can actually leverage it to have a positive biological effect. It's a long way of saying we really need some innovation, and stem cells and all these other molecules that the cells deliver every day could really, really make an impact. But, you know, this could get really complicated really quick. So maybe you should get an expert. What do you think?
I think we absolutely need an expert. It's kind of the Learn Skin podcast way, my friend. Let me start by saying that we absolutely have an expert. We have Greg Maguire. He is a former professor of neuroscience at the University of California, San Diego. He's been a scientist, innovator for many years, has over 100 publications, and he's got a book which exactly hits the topic we're talking about: Adult Stem Cell Released Molecules, A Paradigm Shift to Systems Therapeutics. And this was published in 2018. And he's also the co-founder of NeoGenesis, which is a skincare company that we're going to also talk a little bit about what they're doing because it's pretty innovative. But first and foremost, Greg, welcome to the podcast.
Thank you. I appreciate the invitation. Good to be with you, Dr. Subramani and Lavtav, Raja and Hadar. Great to be with you.
Yeah, this is very exciting. I want to dive straight into it, Greg.
I mean, Hadar, isn't this how we were born, my friend? We started in a wound healing lab. Not that it's all about wound healing, but we were like born from regeneration in terms of the science of our dermatology careers.
Oh, absolutely. I mean, and it's fascinating, and the skin is so readily available to study this. So it makes perfect sense to grow from our wound healing labs into dermatology. And regeneration has always been a challenge, you know. But I really want to start in the beginning and the root of it all, the stem of it all, the stem cells. And, you know, it's a hot topic right now. Everybody's talking about stem cells and all these packages that they can release and their potency. But Greg, maybe let's start with a bit of a background to all our listeners, remind some of those who had training, but some of those who didn't. What are stem cells and what are these molecules that they release? Why are they so important?
Yeah, you know, back in the day, the embryonic stem cells were in fashion, the cells that develop us from the embryo. And it was in the 1990s when I was a professor at UCSD, we started using adult stem cells and we were genetically modifying them, working in the nervous system, the CNS, to try to regenerate neural degeneration. And we found out we were actually genetically modifying them to release nerve growth factor. In the process of using these skin-derived stem cells, we realized the stem cells themselves were releasing a lot of different molecules that had a healing effect. And that was an aha moment for me. It was, it's not so much the stem cells themselves, like the embryonic stem cells that are creating new tissues. Part of what's going on here is just the release of the molecules by these adult stem cells that I happen to be working with. And so it was quite by accident I got involved in skin, because these were skin-derived adult stem cells that I was using to try to heal the brain, and it was working. But then I realized, hey, these cells probably work better in the skin, And in some ways, the skin is much easier to deal with than digging into the CNS, going through the skull into the brain to try and see how these molecules are working. So we started trying them in the skin, and they worked well. So that was the beginnings of my working with the molecules that adult stem cells derive from the skin do for maintenance and healing of our skin.
I am so excited about this conversation. When I was doing a lot of my basic science work and I took a year off in medical school, I
Yeah.
was literally focused in on bone marrow derived mesenchymal stem cells and looking at how they might interact with keratinocytes and fibroblasts and what kind of factors they release. And I mean, they were clearly different from just your garden variety fibroblasts. So, can you speak to like the stem cell populations that are out there? And can you talk about adipose derived mesenchymal stem cells? Like what makes them so special, say, compared to bone marrow, or are they?
Yeah, they are. I mean, both have remarkable properties. Both do significantly different things. For example, if you think about an open wound, this is how I approach it. If you think about an open wound, what comes rushing in? Amongst other things, bone marrow, mesenchymal stem cells, and platelets, and they come in to induce a lot of inflammation, a lot of proliferation. They're trying to close the wound quickly and fight infection. And with that, you have things like fibrotic scarring, you have too much inflammation, and those bone marrow stem cells are meant to be there, releasing their molecules only transiently. So if we were using those molecules over time, you'd be inducing too much inflammation, too much proliferation, a pro-oncogenic state. Whereas if we're using the adipose mesenchymal stem cells derived from the skin, from hypodermis, as I like to call it, um, these are the cells that evolved and developed in our bodies to reduce inflammation, to reduce fibrotic scarring, and put the immune system, both the innate and the adaptive immune systems, into a pro-healing state. And it goes back to Ellie Tanaka's work in like 2007, 2008, where she was talking about tissue-specific stem cells. Working over in Germany at the Max Planck, she developed this concept. And I took it to mean and started using that concept that use cells from the specific tissue to heal and maintain that tissue. And look at how the system works. Look at how Mother Nature evolved and developed. And it's the skin-derived stem cells and fibroblasts that do the long-term work. It's the bone marrow mesenchymal stem cells that come in and do the punch work really quickly to close the wound, induce a lot of inflammation to fight infection. Whereas the mesenchymal stem cells from adipose tissue, hypodermis, they're going to reduce inflammation, really bring it down, shift the T cells from Th1, Th17s over to Tregs, and macrophages from M2, pro-inflammatory, to M1 to M2, and put the macrophages into anti-inflammatory pro-healing state. Whereas the bone marrow mesenchymal stem cells inhibit that process from M1 to M2. So that's why we chose to use the adipose stem cells to derive our products that are going to be used, more than transitorily to maintain and heal our skin.
Now, speaking of which, can you maybe broaden out the conversation? Because that was great, just giving us a background on these stem cells. What do stem cells release? What is it that they're releasing? And we are going to touch upon exosomes. I know everybody wants to talk about exosomes, but before we go there, just what are the things that are being released by stem cells that make them so unique?
Yeah, boy, the list has grown since I know both you and Hadar are involved in this work at the university. But, and we used to hear so much just about the growth factors. And the growth factors, of course, are very important. And equally, if not more important, are the immune modulators. So you've got growth factors, immune modulators, and depending on the cell type, It depends on how you modulate the immune system. So again, the adipose mesenchymal stem cells are going to take you to a place of immune modulation where you're reducing inflammation, where you're bringing those T cells and those macrophages and other cells to a pro-repair state. We've got antioxidants in the mix. There are matrix proteins that are being released to help rebuild the matrix. There are, and I love this, this was so intriguing to me years ago to find out, the stem cells are releasing heat shock proteins. And interestingly, mentioning exosomes, there's some evidence that these heat shock proteins, which repair other proteins, these heat shock proteins inside the exosome may be finalizing some of the other proteins, 3, 4, 5-dimensional configurations. So some of the processing of the proteins to get them into their final state may actually be done in the exosome after it's released from the stem cell. So there's a lot going on. There's some important work came along that stem cells, fibroblasts, are releasing matrix molecules like HAPLN1, which is a binding protein. And as you lose this protein, as we age, you induce your risk of melanoma and metastasis of melanoma. And so there's a lot of important molecules that are being released by these tissue-specific stem cells in the skin. There's a long list, and as you probably know, many people, including us, are searching for the different proteins to understand what exactly the stem cells we use are releasing. You can culture and stimulate these cells in different ways, and we do it in ways here in the laboratory at NeoGenesis to put these cells into a state where they're going to release a set of molecules that truly are anti-inflammatory, pro-repair, and reduce fibrotic scarring. The other thing that's really burgeoning right now are the microRNAs, and so we're finding microRNAs that are released by the adipose mesenchymal stem cells that reduce inflammation, that reduce fibrotic scarring, microRNAs that may tend to help from the adipose mesenchymal stem cells that may help the fibroblasts to go into a more primordial state so that they're better producing anti-inflammation molecules and better producing molecules to repair the matrix that are antifibrotic. So that work is really burgeoning worldwide, and it's really nice also to see some of the work is burgeoning also in China now. Some really good work coming out of China. So I used to work in Japan and saw a lot of good work starting to come out of Japan. And while I was in Japan, this is back in the late 90s, we started seeing, I used to have mainland Chinese students, we started to see China coming up. So we're seeing all this work coming out from around the world, including China, Japan, India, all over Europe. And boy, it's hard to keep track of it all.
Yeah. And I want to get back to the fact of things that are hard to keep track of. But I want to thank you, first of all, Greg, for putting this in context. I think a lot of folks who hear stem cells, they think embryonic stem cell and they're freaked out. You're going to put the scream and I'm going to get another arm to grow or something like that. So thank you for putting that in context. We're not talking about bone marrow stem cells. We're talking really about adipose-derived stem cells. And I thought it was really nice how you explained the idea of changing the environment rather than direct effect. These kind of smart cells, they deliver their molecules and change an environment more conducive to achieve a set goal. And this is where we're getting to the complexity of things. So you kind of mentioned in passing, but a really important principle in what you do is that you don't just take these cells and say, hey, let's put in the cream, whatever, and see what happens. You actually have a system to the madness, because you mentioned these cells produce thousands, if not millions, of different molecules. And the question is, how do you sort this out? Now, you mentioned something about stimulating cells. So you kind of put them in a culture, right? Let them grow a little bit. And then you add something to the culture. I would say maybe you add something to piss them off, or maybe you add something to make them more in a nirvana state, or maybe you can add stuff to make them, react. And how do you do this? Briefly, of course, the goal is not to get technical, but how do you know what to stimulate and how to achieve that result? Because it sounds to me, daunting to even begin to kind of tease out what kind of ingredients you add to the mix there to really achieve that goal.
It is daunting. And it goes back to again, to Ellie Tanaka's work at the Max Planck. And these cells are going to be derived, of course, from embryonic stem cells, and they're going to change their character partly based upon the environment in which they exist. So something existing in the compartment of the skin versus the bone marrow is going to have a very different phenotype, if not genotype as well, because the genotype of the different cells can also be different. It's not that every cell has the same genotype. We know that's not true anymore. But yeah, so to bring these cells into the laboratory, first of all, they have to be characterized. They have to be clean, no adventitious agents. And they're also karyotype. You don't want some out of whack cell that you're culturing and you're multiplying and it's producing some odd set of molecules. But a lot of this is finding out the right parameters is based on all of this great scientific work that comes from around the world, and then duplicating those processes for the molecule set that we want, and then make sure that we standardize that. And so there's certain conditions like setting the temperature, the CO2, the oxygen levels, that we know from the literature, from our work, is proper. And then what we're doing is we've done work in the past where we work with proteomics groups to see what molecules are being released. And we're continuing that work with the proteomics people, both at UCSD as well as some local. There's a German proteomics company that set up shop here in San Diego, so we're working with them as well. But part of this is standardizing procedures based on the literature, based on what we discovered, make sure that's all standardized from batch to batch to batch, and then actually testing these molecules out. We've done work with the molecules, safety data and efficacy data. We took the molecules, for example, into it happened to be brain tissue, so neurons and other brain cells, to see how these molecules were actually acting at the cellular level and the subcellular level to make sure they had really beneficial effects at the cellular level. And they did. And we published that. And it's work in progress. If we can make these sets of molecules better by our understanding and others, then we will do that. And if something came up where there was a different phenotype of the cells we use, or a different cell from what we use that we find out is better, we can easily switch, because we could take a bone marrow mesenchymal stem cell, for example, and just switch it out in our culture stimulation system, and it'd be just fine. It's no more expensive. It would basically be cultured and stimulated in the same way. So we have room to operate using different cells. And again, we have tried different cell types, and we've honed in on what we have right now. We're trying some more cell types, which maybe, a year from now we could talk about. But, there are other cell types we think could be beneficial to, whether it's the skin or hair growth. We're constantly looking at new things.
Yes, that sounds really exciting, because this idea that you can, no pun intended, but regenerate yourself year to year, batch to batch, really hone in on the best stuff, and really sounds really complex process. So when you get a product in your hand, a lot of thought and testing went through to get this into your hand. But so now we kind of got into the source of these cells and what they could do and how you really activate them in the right way to get the effect that we want. Now, my question to you is how we deliver this. And I think maybe we get into the exosome story here a little bit, but how do you deliver this? How the cells deliver it, but also how do you put this now into a product that a person can apply?
This is so important. We were shocked back in the 90s when we started using these molecules from the adipose mesenchymal stem cells and fibroblasts. We were using them on wounds, so open wounds, and we were seeing good effect there. And it was no surprise to us there, because there wasn't intact skin barrier. And so we knew that proteins, even if they were big proteins, were probably able to penetrate at least to some degree. But we were seeing in adjacent tissue that the effects were good on the adjacent tissue where there was good barrier function. So we didn't know what to make of that. We thought, well, maybe the molecules are just diffusing through the skin underneath the barrier, something. But so we said we need to try it on skin that has barrier function. And we tried it and we saw positive effects. So then it led us to think, well, this is not what we were taught in grad school and med school about big proteins and how they're unable to penetrate,
Yeah.
right?
Oh, listen, everything you learn is subject to change. You always have to doubt. I mean, that's the key to good science. But go on. This is a fascinating.
Question authority, as we were always told at Berkeley, always question authority. So we started exploring this, how could this be happening? And well, there were lipids in the mix, there were proteins in the mix, there were microRNA. And then delving into the literature, I came upon there's such a thing as an exosome, an extracellular vesicle. And, it wasn't my work doing this, but others were looking at exosomes, extracellular vesicles, what was packaged in them, and how they could penetrate tissues. And, the realization, of course, came about that probably one of the reasons why these molecules are penetrating intact barrier, whether it's going through stratum corneum or down follicles, we weren't sure. But there's now some evidence that these exosomes using human cadaver skin can indeed penetrate at least partially through the epidermis. So they're labeling the exosomes, the scientists, and tracking the exosomes going through the epidermis. Indeed, they penetrate. So studies in progress, but they weren't able to track the exosome down into the dermis. But when they applied the exosomes, they could see collagen production turned on. So there's evidence that these molecules in the exosomes are somehow penetrating all the way down to the dermis. That's consistent with what we find. So the exosome becomes very important as a delivery and protection device. These exosomes, they exist in the gut at pH 2. They exist at pHs, 7.5 and higher, and at different temperatures. You can have a fever and your exosomes are still intact. They're very robust, so they can endure a lot. We have to be careful in the laboratory when we're mixing them. We can't use a lot of shear force, otherwise we can break them open. So we're very careful when we're mixing them. But, in the body, they're very robust. And it's even in the skin, you can, they've tracked exosomes moving through the skin naturally, not things that are topically applied. So it's a very robust system. We're trying to learn more about it. And then the other thing that's intriguing is, there's the exosome fraction of molecules, but then there is a group of soluble molecules, including soluble lipids and soluble proteins. And some of I guess some are estimating now that about a third of the proteins in the body may be disordered proteins, so intrinsically disordered proteins, at least to some degree. So these are smaller, kind of stringy, not so globular, these proteins, and they may have better penetration quality. So this is work in progress to understand how is it, we can put our molecules on skin and see effects, and we can put molecules on skin that has very much intact, whether it's fully intact, I can't say, but if you look at intact barrier function, you see these wonderful positive effects. And how are these molecules really diving down into the dermis? So work in progress, but the exosome becomes very important.
Thank you for doing this. And what you said initially really caught my attention is how amazed people are by how powerful these molecules can be. And, I'm here at the University of Miami, and we have a big group that deals with wound healing, and Van Badiavas, researcher here, who's one of my mentors and done tremendous work. And I remember him showing me for the first time throwing these exosomes on a wound, on a burn wound that healed as if nothing happened. it was really shocking to see. So really, the effect is not, you were not exaggerating. I think there's a lot of potential, and I appreciate you being so conservative and saying that we're still learning about these things, and we really need to keep an open mind and understand that some of this has been sorted out, but a lot has not. And this is a year from now, we may have a whole different conversation. So I really appreciate you going into this. I wanted to ask you about the actual process of growing stem cells because, and I don't know this for a fact, but I'm going to imagine that growing stem cells on your own, which is what I believe you guys are doing, is probably more expensive and labor intense than actually ordering it from a third party. And I think you guys do this in house, right? So
Yeah, we wouldn't order from a third party. We believe in quality control and knowing that our stem cells are healthy. I mean, we visualize the
Greg?
cells every day. We can see that they're very healthy. There's various tests we do to make sure they're healthy. We've done a series of safety studies. We do take the time and expense to culture and stimulate these various types of stem cells ourselves. When I first brought about this technology, invented it, of course, standing on the shoulders of many other scientists. No one else was doing this sort of thing. No one else was capable of doing this. And our team would have to teach whoever was going to be doing the culturing for us. So why not just do it ourselves? And we were particularly concerned about, we've heard stories, we've seen publications where when companies, either skincare companies, pharmaceutical companies, outsource the production of their products, there can be a lot of issues. Lack of quality control. People just aren't as engaged or really committed to making a quality product if it's not their own product. And another thing that happens out there is you frequently see, and this is published in the pharmaceutical world, you frequently see things such as contamination. So if someone is making your product plus another product and other products as well, sometimes they cross-contaminate your product. You may have things in there that you don't want, or things have been left out. So yeah, we take the expense, the time. We keep everything in-house, from making the molecules to formulation to manufacturing the products to filling the bottles, and then also doing our own sales and marketing. The marketing story is really important. We want to tell the story where these products work, where they don't work. We don't want to be just selling stuff. We want to be bringing products to the marketplace that actually work. And if they do, then we can be rewarded. So yeah, we take the time to do all of that. Thank you for that question.
Yeah, actually, let me jump in here because, Greg, as we have this discussion, it's really opened up my own thought process on, where could you use this? And, we've talked a bit about regenerative medicine. We've talked about some of maybe the origins of stem cells, especially in the wound healing space. But as I look at dermatology, I feel like there are many different aspects of even aging that can set in where people are not necessarily trying to be anti-aging, although we use that term, but trying to really understand how do we slow that process down or maybe even reverse it. And another arena where I feel like there's a niche for something like this is in the hair space, because right now there's a lot of people doing pharmaceuticals, there are some herbals, but then when it comes to growth factors, we're a little sparse. Usually we have platelet-rich plasma injections.
Right.
Of course, that requires drawing blood, although the studies have shown that it is effective. But I just have not seen anything come to the market that's topical. And I feel like because you grow your own stem cells, you have an opportunity here to not just look at, say, adipose stem cells, but I noticed that you guys also use dermal papilla stem cells, which are literally the cells that support hair growth. So I'd like for you to just maybe touch upon why you chose dermal papilla stem cells.
Yeah, we use a combination, as you're saying, of the dermal papilla stem cells as well as the fibroblasts and the mesenchymal stem cells together to support the hair growth. And delving into the vast literature on, basic mechanisms of hair growth, it became apparent that these dermal papilla are really just important for driving the remodeling of the hair follicle and driving hair growth through bringing, the growth phase, normal growth cycling, the anagen phase. So we knew that in order for the hair follicle, based on a lot of great science, that you needed at least these three cell types in the molecules that they release: dermal papilla, fibroblasts, and mesenchymal stem cells that are all very important to hair remodeling, hair growth, and making sure the hair shaft drives into that all important anagen phase. Parenthetically, we also see some repigmentation. It's that effective. So we continue to work to see if there's other things we might add in. There's a lot going in, as you know, as well as I, and your expertise overlaps, and you have an understanding of things I don't know, and vice versa. But we're even looking into the fat pad cycling during hair growth and some of the cell types involved in that are certainly associated with hair growth, like the thickening of the fat pad during hair growth. So we're considering a lot of different things. We're a science and technology driven company, so we will be listening to and reading the work of others as well as our own work and trying to drive this technology into the future to become even better set of technology and products that are safe and efficacious.
Well, Greg, listen, we could probably talk for hours on this topic. I mean, I think this area is really growing. The science is really growing, which to Hadar and myself gets us very excited. I want to really thank you for spending time with us today on the podcast. And just for all of you out there, remember we have the Integrative Dermatology Symposium coming up in September, and Greg is going to be there with NeoGenesis, and he's going to be part of that symposium. And we also have some lectures on exosomes too. So we are also entering into this fray because we know that the science is really important and there's just so much that we need to learn and study. But for those that want to find more about NeoGenesis, if you're really interested in trying out their products, testing it out with yourselves, or if you have patients you'd like to try it on, you can reach out to them at info@neogenesis.com. And anything else you'd like to add, Greg, before we close up for this podcast?
Yeah, I would just say, one of the important things that's there in a lot of diseases, including a lot of hair loss, is inflammation. And this technology is so good at reducing inflammation, especially chronic inflammation, both the innate and adaptive immune system. So I do look forward to talking with you more, Raja, learning from one another. Look forward to seeing you at IDS. And I really thank you and Hadar for the invite to have this back and forth with you.
Likewise. Thank you.
And that's a wrap for today's episode. But these conversations are just way too good to end here. Wouldn't you agree, Raja?
Absolutely, Hadar. That's one of the main reasons I get so excited about our conference, the Integrative Dermatology Symposium. Every year, it's a chance for us to continue expanding our minds for what's possible in dermatology for our patients, and also to bring the latest clinical knowledge back to the clinic. And this year's theme has been long awaited. Do you want to spill the beans?
Oh, yes. You don't want to miss this one, folks. This year's theme is Nurturing Skin Resilience, the Science of Aging and Wellness. And it's happening from September 26th to the 29th, 2024.
Yes, and we'll cover topics from conventional medicine to traditional approaches, from inflammaging to exosomes, and from cosmeceuticals to women's health and more.
The agenda lineup looks amazing. Not only the topics, but also the real-world case discussions, workshops, and networking events. No wonder we've expanded the IDS to 4 days. So much more to learn and do.
Plus, you can't go wrong at a brand new resort that just opened up this year at the Lowe's Arlington Hotel and Convention Center in Arlington, Texas.
Texas, here we come! And for our esthetician colleagues, please join us on Sunday for the Integrative Aesthetics track.
So come check out integrativedermatologysymposium.com for all the details. We hope to see you there.